All right. Hello, everyone. Welcome back to the Our Pharma USP 800 Preparedness Lunch and Learn series. That's a mouthful. Today is our sixth installment, and we'll be sharing about and discussing safety information in the EHR. So whether it's your first time with us or your sixth time with us today, we're really glad you're here, and we hope you're able to take away something valuable. We know USP 800 compliance is approaching. We created this series to bring conversation and community to an often confusing and cumbersome subject. So just a little housekeeping for today. There is a Q&A section in your toolbar. So if at any point in the presentation you have questions, feel free to ask and we'll make sure to get to those. And we'll also have some polling questions that will appear throughout the presentation. So make sure to engage with those so we better know how to help you. And now I'll introduce our speakers for today. First, we have Ms. Laura Paxton. She's the CEO of Our Pharmy. She's been working in healthcare for over 35 years, and she specializes in formulary and hazardous drug handling. And then we also have Ms. Charlene Kristen, who's a customer experience specialist with Our Pharmy. She worked as a certified pharmacy technician for over 20 years and now is on Team Our Pharmy. We're so glad to have her. And we're excited to hear from you both today. So thank you. And now I'll pass it off to you, Laura.
Thank you, Carrie. And thanks to everyone who has joined us today. We're so happy to have you. Our hope is that you will leave today having learned something new and perhaps with some good information. If you hear or see anything and you'd like to add to it, please put some information in the questions, send Charlene or I an email. We're always looking to improve what we do and what we provide for all of you. Now, we got two more webinars coming up. Next week, we have When Inspectors Come Knocking. And then finally, on May 25th, we're going to have the wrap up. And there really are some of you who have been with us through every one of these webinars, and we so thank you for that. It gives us a bit of validation that maybe we're saying something of value to you. So thanks so much. I hope that what we're doing today will be helpful. And we're going to start off today's webinar with a poll. Carrie?
Thank you, Laura. So our first poll and our first question for you today is, where does your health organization's hazardous drug handling information reside? So you should see the poll popping up right now. And if you'd please take a second to answer. Give it just a few more seconds. Okay, I'm going to share the results. And it looks like we've kind of got a spattering. 25% said health system intranet, 25% said spreadsheet, 13% said shared drive, 25% electronic health record, and then 13% hard copy. Thank you.
Thank you all very much for that. I'm sure you understand why we opened up this discussion asking that question. Let's see. So, as we work with our clients that we've installed with our software, we have had the wonderful opportunity to observe how they have created access to this very important information on their hazardous drugs. Now, whether you have our software or not is immaterial. What's important is that you get the bigger picture, and that is whatever you're doing needs to be accessible at the point of care for your end users. So where do they need to access this information? They need to access it just like I saw in the polls. Hospital intranet, SharePoint, make sure that these people can have this information on their phones or tablets or other mobile devices. If you have a pharmacy website or a formulary website, really important to have this information there. Inside your EHR is important. I think I saw that 25% of you already have it in the EHR. Congratulations to you for that. It's very important to have it there. And if you have any portals for pharmacists, physicians, make sure it's there. And most importantly, wherever you have this information, spend time training these people on where to find it. Because if they can't find it, they'll kick the can down the road. We've seen that happen. And This is a really, I love this slide, and I'll tell you why. Because we looked at all of our install base of clients, and we looked at our clients who have our software installed at integrated into the EHR, and our clients who don't have our software in the EHR. And what we found was that our clients are twice as likely, these clinicians are twice as likely to use this information if it's at the point of care. And that's so important. And I'm going to tell you a little story that's going to even make that more important for you. So I was talking to a pharmacist in Houston, Texas, and he was telling me about in their hospital, nurse had a PEDS patient come in, and that patient needed to have a hazardous drug administered, and she couldn't find the handling information on their hospital intranet. And so she Googled it. We've all done that. And the information she found on Google telling her how to garb and administer the medication was incorrect. Oh, that's a shocker. And she used that information on Google to do what she needed to do, called the pharmacy after she administered the medication and asked them where to find that information and if she had done the right thing. Realized she had incorrectly exposed, or she had exposed herself to a hazardous drug in that whole situation. So the next thing you know, and that's going to make everything cringe. The next thing you know, she and the pharmacy director and the director of nursing were meeting with corporate counsel, risk compliance, and HR to talk about why she hadn't been able to find that information and how to make sure that anyone in that organization could find that information in the future. So this harkens back to something that Charlene said last week. It takes a village. It takes a village. So it's important as a team to train everyone in your organization where to find this information and to make sure that this information is accessible where and when they need it. To quote Gina Davis from the movie The Fly, be afraid, be very, very afraid. And now we're going to talk about where you find this. So today, what you're going to see are a lot of different images coming from our clients, and you're going to see where they have this information in their own organizations. So this is an example of one of our clients who has their information on their SharePoint or their hospital's intranet. And here are the steps on how you get to that information. And then you see it's circled right here so they know where to find it. Now, look, once again, you don't have to use our software to do this. You can have this on your Excel spreadsheet on your hospital's intranet. You can have it on a PDF or a Word document. So okay. Okay, so this is where you would find it on the hospital's intranet. Now we're going to look at phones and tablets. Here's an example of what this information could look like on your tablet or on your mobile phone. This is an example of a pharmacy website or a formulary website. So notice the hazardous drug link on the left side of the screen, and notice that you see the medication, the carbamazepine has been clicked, and you see the hazardous drug information tied to the pharmacy formulary site. Here is where you find information in Epic. We're going to start going through some of the EHRs now. Here's where you find the information in Epic. So if you're an Epic user, you know that area that's got the web link resources. This is an example of where our clients find that information in their web link resources. And all of this is going to be put up on YouTube. So if you guys want to come back and slow it down and look at some of these images, you can do that. It'll be on our website, rpharmy.com. And here's an example of what it looks like inside the MAR. So notice we're looking at carbamazepine. Notice that this client in the MAR has a link to their RHAZ drug. This could say whatever. It could say a link to hazardous drugs for whatever hospital it is. When they click on this link, it opens the specific information in a new window so the nurse can easily grab that information and move along. My slides are jumping today. So here's another example from a different client, and they have theirs labeled differently in Epic by hazardous handling instructions. Notice also that they have a special icon on their MAR that tells the nurse exactly what group, what NIOSH group this medication belongs to. And then here is a screen for order entry, where you can click on the hazardous handling instructions and it opens in a new window for the order entry screen. And notice it's opening to that specific drug. And here we have a link to an image of order verification in Epic. Notice this is order verification and dispense prep. So you have a link to the order verification. Here you see where the clinician clicks on the link, opens the information in a new window, and you can get the information you need and move along. And Carrie, we have another poll.
Thank you, Laura. So our second poll for today, we're asking you, assuming your hazardous drug information is in an electronic form, who has access to it? So just 1 second, the question will appear on your screen. And if you'd please answer. I'll give it a few more seconds. Thank you, everyone. So it looks like the majority of you, 89%, said all staff have access to your hazardous drug information, and then only 11% said pharmacy staff. Thank you.
Wonderful. Thank you very much, Carrie. And thank you all for responding to our, and here we have a little bit of Cerner that we're going to show you. And notice that this is in the Cerner toolbar. And you see that our hazard drugs, this could just say hazardous drugs depending on your organization. So when they click on that, it's going to open that information and your end user can find very easily what they're looking for. Another image of Cerner, one of our clients actually, and this doesn't sound like that big a deal, but it really was a big deal. One of our clients figured out how to embed this information at the drug level in Cerner. So when the end user clicks on this information in Cerner, they're actually going to open up the main page. So it could be your main page of hazardous information. In the case of this client, it's our website of their hazardous drug database. And it's right there inside that Cerner. And then finally, we have another Cerner example, and this is using the power chart. So you see the links in the power chart, and from there, it shows all the links available for them and for their end users. So that is a pretty comprehensive list of all of the EHRs that we've seen. And remember this, you may not have Epic or Cerner or Meditech as an EHR, but if your EHR will allow a hyperlink to go inside of it, we can interface with that. That's what we've found to be very successful with any of the EHRs that we've worked with. So does anyone have any questions? Carrie, I can't see the bar. Are there any questions?
I'm not seeing any questions right now.
All right. Well, once again, you might think of something later. Email me, email Charlene, either one of us. We love to take your questions. So just email us and let us know any questions that you have. I've already told you about the next seminar or webinars coming up when inspectors come knocking and the wrap up. I want to thank you all very much for joining us today for this call. I hope you learned something. This is a QR code to hazardous resource page that we've created for all of you. As you peruse this page and you find things on here that are useful, if there's something that you use in your practice that you don't see here, email one of us, please, because we want to make sure that this works for everyone. Whether you're buying my software or not, I want to make sure that people have the information they need, because there's not a lot of talk going on around this. So let's start a conversation, okay? And then finally, the next QR code that you can scan is to sign up for webinars for next week, the final two. I want to thank you very sincerely for all of your time and your attention. I apologize, I had to turn off my video, but my audio was getting wobbly, so I had to turn it off because it was too much bandwidth. But just let us know if there's something you'd like to talk about or something we haven't talked about. And we thank you so much for your time. And Charlene and Carrie, thank y'all so much for helping get this thing going and get this done today. And I hope all of you have a wonderful day, and we'll talk to you next week. Thanks so much.
Thank you.